This video is brought to you by some of Hope Association's most senior staff at 4th Street. The intent of this video is to show you how to safely use an automatic Hoyer lift to transfer persons with disabilities from their wheelchair onto the toilet and back off again into their wheelchair. It's important to note that wheelchairs have variances, such as some can tilt and some cannot. The one in this video cannot. Please see a senior staff member in the home that you work in to find out whether or not there are any specific positions that the wheelchair the residents use within that home need to be in during transfers.
Lean side to side. Want a triangle at the neck. And I will pull both of the big straps under the butt. There we go. Shimmy it just to make sure it's under the butt. It is not. So I just pushed it down under the butt, and now it definitely is, because it's not wiggling as much. It's tighter. And then we lift under this leg, pull it, stuck on the chair, pull it under like that and lay it over this thigh. Same with this side, lift the leg, under the thigh, and lean it over this thigh.
For this specific setup at 4th Street, you'll see that they hook the red for the legs and the gray loop on the yellow for the upper portion of the resident's body. Always communicate with the resident when you're preparing to go up or down with the lift.
Yep, going up. Hold the lift so it protects his face. Under the leg and the back, just so he feels supported. So I'm gonna push the hips while you go down. All right.
With this specific resident, it's important to tip his head back gently so that he doesn't lean forward and hit his head on the lift.
He is gonna lean my way, so I'm gonna come stand to this side and brace. You hold him secure. I'll disconnect him.
Once the resident is safely lowered onto the toilet, please remove the gray and red hooks from the automatic Hoyer. Gently untangle the straps from between the resident's legs and work with your coworker to lean the resident forward and remove the entire sling from behind the resident.
And if you need to boost him back, sometimes you do, we lift under his arm here and under his leg, and then you count with your partner, 1, 2, 3, slide him back. Once he's back, what side's going first? Your side? Side. Okay. And then I do my side. And then his elbow goes here.
Once the toilet harness is in place, you should ensure that the resident's genitals are tucked between his legs and into the toilet area with a washcloth placed on top to avoid any accidental leakage. A towel is then draped over the resident and fastened to the harness for warmth and added privacy.
There. I've tucked him. I'm using this towel to help keep his penis in the toilet so he doesn't pee on the floor like that.
The body positioning in this video is specific to a resident at 4th Street. Please communicate with a staff member in your home to determine if there are any positions
Yell
specific to those
when
residents.
you're done, and you walk out. And that's that. And that's how you get him on the toilet.
Some time has passed, and now we hear the resident
I
yelling.
always open the door a little bit. I always reach my hand in and wave just to try to get his attention. And then you stomp on the floor so he feels the vibration all the way. Sometimes you'll see him jump because you did startle him. And then you ask him, may I come in? He'll tell you yes or no. He happened to tell me yes, so I'm going in. Of course, I'd get a second staff before moving him off the toilet. Staff, help. Thank you. So then we start by taking off the towel. And then I'll remove this towel and toss it in the laundry. Grab gloves. And I always do a little bit of toilet paper to untuck him. So lift this leg, untuck. Go ahead and unbuckle. And then this hand, like that. I always put him back up here and hold him. And now I always move this arm down so it's not resting on this while I lean him forward. On this side. Good. Good. Yep. Yep.
Always make sure you lift his leg because you can get the toilet seat when you're crossing them.
Bottom one always goes red. The yellow, but on the gray. So I always hold him and then go like this. I'm gonna hold the lift away from him while I'm still holding him.
Tell him you're going up.
I'm gonna try to take my hand out now because I know the sling has him.
So you'll clean him up
And then grab a leg kinda here just to hold him while the other staff cleans him up. And you always warn him when you clean him up so it's not a surprise.
and then you get these up as high as you can get them. And I'm gonna face him away from me.
There you go. Good up here.
The resident at 4th Street likes to view his bowel movements. Please communicate with the senior staff and residents in your home to determine if this is true for them.
And then you have somebody come behind to help guide him down.
And again, we usually have his chair tilted to help us.
And you want it kind of like chest level or a little lower so you're not fighting real hard on the straps to get them on or off. And then to take the sling off.
Go up the pant leg usually. Quit kicking me. And just cross. And then the same with this side. There we go. And this side.
It is a lot harder in this chair.
Yeah.
And I'm just pulling my side up pant leg over here. And then you lean them forward. And the other one pulls this out and just put his pants up. And that's that. And then you buckle his seatbelt. And then that's it.
Limitations. Equipment and positioning in this video are specific to residents at 4th Street. Please communicate with your manager and senior staff at your home to determine whether your home's equipment or your residents' needs are different. This video is not designed to be the entirety of Hoyer lift training. You should still participate in live practice sessions with senior staff from your home, and no two newly hired staff may operate a Hoyer lift together without the guidance and supervision of a senior staff at any time. Notes: always wear PPE, personal protective equipment, such as gloves, when participating in any self-care with the resident you are supporting. 2. Always communicate in the resident's preferred communication style throughout the entirety of any self-care activities. Sam demonstrated this when she re-entered the bathroom. 3. Always communicate with your coworker as you complete a 2-person lift to support safety and cohesion. Credit: thank you Sam Blanchard, Angela O'Leary, and Stella Blanchard for demonstrating the proper use of the automatic Hoyer lift.